My name's Megan. I'm the Public Involvement Lead for the RDS South Central. I'm going to be doing a really quick talk about patient and public involvement in the public health research application process over the next 20 minutes. It is a bit of a whistle-stop tour and there's a lot of information, so I apologise, it's quite quick. So I think one thing that I find quite helpful to reflect on when talking about public involvement in research in general is to think about how the different ways that the public interact with research and kind of to help us kind of contextualize what exactly we mean by public involvement. So perhaps the most common way for the public to interact with research, certainly the most common way that, that the public think of when they think about how they interact with research is through participation. So as we all know, participation is about members of the public who are recruited onto a research study as participants to have kind of data collected from them. Engagement is often talked about alongside involvement. It is slightly different. So engagement is really about sharing information with the public, disseminating research, for example. The public play a very passive role in engagement, so they sort of receive information rather than anything more active. And involvement, which is what I'm going to be talking about today, is about the active collaboration of public members and researchers on the sort of design and the delivery of the research process. NIHR actually define PPI as research that's carried out with or by members of the public rather than to, about, or for them. So PPI, or patient and public involvement, is a term that's used by NIHR. The principles of PPI, however, do exist in many different fields and different disciplines. So, you know, for example, social care, disability rights, international development, for example, all have a really strong culture of forms of involvement. So whilst they may use different terminology, the principles are often very similar or the same as patient and public involvement. And I've just got on the screen here a few examples of some of the other terms that PPI kind of may be more familiar to you by, or, you know, maybe known as in different kind of areas. So when thinking about public involvement in a research application or public health research application, I think it's really important to think about the research cycle and how the role of the public can fit in with each of the stages within the research cycle. So as you can see here, I've got a diagram with some of the key points identified. When you're designing and applying for a research grant, your main focus will be primarily on these three areas. So this is around the identification and the prioritization of the research that you're doing, the design of the research, and also the development and the writing of the grant proposal. So these will be the kind of three areas that you'll be looking at completing before a research grant is submitted. So in terms of identifying and prioritizing, so you may wish to consult with and collaborate with different groups, service users, organisations, wider stakeholders. I guess this is where there's a slight difference in some public health research to more traditional NHS research, where the focus will be primarily on involving patients with a particular condition, for example, whereas the people that you might be seeking input from maybe kind of from different communities or from different populations, or more generally the public. But having conversations with different groups, different service users, for example, can help you to understand some of the key priorities around your area of public health research, can help provide a different perspective to the academic perspective, for example. Discussing your research question to ensure its relevance and importance, as well as helping refine the final research question, can be a really useful area of input. So the study design, the design of the study is probably the main element in which public involvement can support in the pre-grants phase. So a lot of this will depend on your individual study and the methodology that's being used. If you're unsure, it's always a good idea to have a discussion with your local RDS, so they'll be able to provide you with some really specific advice around your particular research project and kind of what you need to do. I'm going to give a few generic examples, so it may be helpful for you, kind of give you a few ideas. So, for example, if your study has participants that are being recruited, it's helpful to ensure things like the recruitment methods, for example, are acceptable. This can really greatly improve both your recruitment and your retention rates, as well as making sure that you're reaching the right cohort of people in the best way possible. And this is particularly important when you're working with marginalised groups or vulnerable communities, for example. PPI members may be able to help with thinking about data collection methods. So they may be able to comment or review on sort of questionnaires you might be planning on using. They may be able to talk you through or work with you around the logistics or the contents of semi-structured interview guides, for example. There's also a role to play in the developing and the writing of a grant proposal. So in particular, plain English summary, it's really helpful to get input from public members on. This can actually be co-written by public members, or it could be reviewed by public members, public representatives, to ensure that its kind of readability and accessibility is appropriate for a public audience. Depending on the skills of public members working with you, they may be happy to review the wider application form, advise on kind of other public facing aspects of the application form, such as your dissemination strategy and things like that. So when you're writing your application, you'll also need to properly plan and describe and cost for your ongoing PPI work. So for this, it's useful to think about the areas of the research cycle where you're actively undertaking the research, and consider how public members could meaningfully be involved in these stages. So, I mean, again, it can be really hard to give generic examples, as it really does depend on, your individual project and your question that you're asking and the methods that you're using. But I am just going to give a few examples of the types of things that you might consider. So in terms of public involvement in the undertaking or the managing of research, so you may think about having public members at a strategic or managerial level. So for example, in a trial management group or a trial steering committee, what this can do is help provide a kind of a public voice or a service user voice and perspective at a decision-making level. Public members can also play a really important role in supporting the development of any kind of patient information or public participant information facing documents, such as participant information sheets or consent forms, for example. You may work with them around sort of ongoing support and advice around recruitment, recruitment strategies, if you need to make amendment and sort of changes and things like that. You could also consult with public members as you start to analyse your data to get a kind of different perspective and different interpretations of the kind of themes of qualitative research that are coming out, or the results and things like that. And it can be a really interesting role for public involvement members to play in the process. And lastly, dissemination. So collaborating with public involvement members at this stage helps to ensure that you're able to sort of more effectively disseminate the findings of your research. You're more effectively able to engage different kind of population groups and different communities and things like that. Make sure that the chances of service users and the public accessing information about your research are increased. You could also use public members' existing networks and links to help disseminate information, and potentially think about things like co-presenting research findings with a lay member. And this can really sort of help bring your research to life in a sort of conference setting or something, for example. So there's been a lot of discussion throughout the day about the importance of addressing health inequalities, and it's something that has particular relevance in public health research. As Brian Ferguson mentioned in his presentation earlier, these are, we've seen inequalities reinforced and exacerbated by the pandemic. So, now more than ever, it's really important to be thinking about the kind of implications of this and how kind of diversifying PPI can potentially support diversifying research. So this idea of diversifying PPI, ensuring PPI representatives represent a range of different demographics, or appropriately represent the particular group that you might be researching, is an area of strategic importance within NIHR. So you're going to need to think really carefully about who you're asking for input from, and whether you can reach out to different populations and how you go about doing that in a way that's kind of appropriate and meaningful. Again, Brian Ferguson mentioned earlier the importance of developing a kind of research presence within disadvantaged communities, and how we think about moving towards that. I think this is something that's really intertwined with how we carry out and undertake public involvement work, particularly in public health research. And I think there's an increasing drive towards taking a more community development type approach to building ongoing relationships with underrepresented communities. I mean, this is obviously an approach which is kind of hugely time consuming and capacity demanding. So there are lots of challenges from a logistical point of view. But in terms of establishing meaningful and ongoing input from communities, you know, where there may be, for example, historically a lack of trust or something like that, community development type of work takes a longer term approach to community involvement, building relationships perhaps beyond the length of a individual research project or study. And so that may be something that you're thinking about kind of longer term. Okay, so just to talk briefly about the actual application forms itself. So within stage 1, there's no kind of specific set area where you're talking about, or you're asked to talk about PPI on its own, as it were. There is a checklist where you're asked to confirm you have appropriate and relevant involvement of the public. However, there is an expectation that, you know, you are still talking about it within the application, and it's about kind of talking about it throughout the whole of the application form, demonstrating that it's actually embedded and well integrated into the relevant sections of your sort of research plan, for example, the justification if necessary. For stage 2, you will be asked to go into a lot more detail about the kind of the PPI that you've done and your plans for PPI. So this will include describing any involvement activities that have been done pre-funding. Think about the first 3 areas of the research cycle that we've already discussed. You'll be expected to give examples of PPI activity that has already happened, how these members have fed into things like the prioritization and the design and the development of the grant applications, what has been done to take on their suggestions and their advice, how the research has changed as a result of that. You'll also be asked to go into a lot more detail about your ongoing plans for public involvement. So a clear description of all ongoing activities, how these will support the research, how these will be facilitated and costed and things like that. You'll also be asked to name a PPI lead. So there was a question earlier about who would be an appropriate person to be a PPI lead. I think, you know, as Julie said, time is really important, and experience. So some experience of public involvement in general, but also particularly important if you're going to be working with a particular marginalised community or something like that. Links into the community, time to kind of establish relationships and invest in the public involvement work that you're doing. This individual may be a researcher who's also kind of carrying out work on the study as a researcher. They may be a dedicated PPI member of staff. They could potentially be a public member. There is a lot of responsibility that goes alongside it, so this would need careful consideration, but it's certainly a possibility. So the role of the PPI lead is essentially to take responsibility for delivering on the PPI strategy throughout the course of the project. So some of the responsibilities include things like setting and refining the final public involvement strategy as the project kind of progresses, acting as a single point of contact for all PPI members, all PPI contributors, communicating to public contributors about the project status, giving them feedback on their involvement and the impact of their involvement, writing up any kind of PPI sections for reports for the NIHR, including kind of addressing, ensuring that you're meeting milestones that you've set out. There is a full list of the requirements that you can find in the PPI lead guidance. So I do recommend having a look at that if that would be helpful. So this is just a brief slide, as I think it's important to recognise at the moment there are really unique challenges regarding how PPI work is carried out. And again, unfortunately, this sort of change, this move to online can and does disproportionately affect certain demographics or certain populations. You know, to use the example of a kind of homeless community, there would be obvious challenges in terms of meaningfully involving people in a kind of safe way, particularly as these individuals may lead kind of more chaotic lives, may have less access to kind of technology or Wi-Fi and things like that. So I think, you know, just to acknowledge it is hard at the moment, and it can be even more hard when thinking about working with vulnerable groups. What I would say is contact your RDS, because there is support available. And also, if you haven't already, try and establish links with kind of not-for-profit groups or kind of community or charitable groups who have been doing a just brilliant, fantastic job over the last 12 months to make sure that people from kind of different marginalised and vulnerable communities are still being supported, and they may be able to work with you to help you think about some of the strategies you could use to kind of meaningfully and safely involve people. It's also important to remember that public involvement members should be offered payment for their time. So just like any other member of the team, this would be costed into a grant application. So it would be part of your award. So any kind of ongoing PPI activity work would be costed and paid for as part of the grant. For any work done prior to an application being submitted, your local RDS will run public involvement fund application process. So you can apply for a small pot of money to kind of support pre-funding PPI activities. So that is something that's worth looking into. Okay, so I've just got a couple of minutes, I think, if that's okay. I'm going to do a really quick case study. Professor Julie Parks spoke earlier about a couple of studies, both of which I've worked with her on. I'm going to just talk quickly about the Gateway study and the PPI work that we did for Gateway, just to try and help contextualise some of the things that I've been talking about. So in terms of the pre-funding work that we carried out, so this particular project was driven by stakeholders in the field. So the intervention was actually developed by a charity supporting young people in the criminal justice system, the Hampton Trust. Hampton Trust and Hampshire Constabulary collaborated really closely with the academic team in the kind of refinement of the research question, so ensuring it was kind of meaningful on the ground and relevant to service users and young people. In terms of the design, so facilitated by the Hampton Trust charity, I think this is a really good example of how we would really have struggled to access the people with the lived experience that we wanted to get input from without these links in the voluntary sector. We were actually able to meet with several groups of young adult offenders who were on similar programs, so similar to Gateway. We would drop in at the end of one of their group sessions and ask their permission if we could stick around and have a kind of informal conversation with them. This kind of ad hoc approach worked quite well. We talked about things like barriers and facilitators to taking part in the research, as well as exploring incentives for participation. We also worked with a smaller number of these individuals who agreed to meet with us separately. So we talked about things like the questionnaires that we would be using to collect kind of health related data. So for example, there was a drugs use questionnaire which had been validated in the USA, and essentially some of the terminology that they used just didn't translate well into kind of UK lingo for kind of recreational drugs. So it was really helpful to get some input around what language we ought to be using that would kind of mean something to participants. In terms of the developing of the proposal, we worked with a young adult patient and public involvement group that were already established to co-write the plain English summary. So they had no sort of lived experience necessarily of the justice system, but they were able to make sure that that was appropriate for a kind of public audience. And we collaborated closely with sort of charitable stakeholders and things like that throughout the course of the development of the proposal. In terms of ongoing public involvement in the trial, so this was all determined and decided during the application process. It was all sort of planned and written up. It fell into 3 broad categories in terms of who the public involvement members were representing. So these were service users, victim involvement and community involvement, and I've colour coded them just on the next couple of slides just to make it a little bit easier. So in terms of managing, the trial steering committee has members representing victims of crimes on it, as well as a member who themselves is someone who's a history of offending and is now a kind of mentor and support worker for other young offenders. In terms of undertaking the research, so there's been continuous input. As Julie mentioned earlier, actually, there's been continuous input from young people, particularly around the recruitment strategy. So there's been so many challenges with the recruitment, partly due to changes in because of COVID, partly due to the fact that it's a very difficult population to kind of recruit, and a lot of these young people are vulnerable and have kind of chaotic lives and things like that. So there's been some fantastic input from young people in the sort of justice system in different programs. One example of some input that they've had, they recommended that we made a video because that would be more accessible to people than a patient information sheet or participant information sheet. And then they worked with us to determine the kind of content of that video, and make sure that it kind of addressed all the potential concerns that young people might have, such as will their data or information be shared with the police, will their answers be shared with the police. A community panel was established, and their input was amazingly valuable in terms of supporting kind of any public facing content. And that's helped us kind of consider the wider potential perceived issues around or concerns within the community around kind of outputs from the study. And victim representatives are being worked with and will be worked with to develop the semi-structured interview guides around the qualitative victim work and the process evaluation. And now I'm running over, this is my last slide, I promise. So in terms of analysis and interpretation, collaborators from all 3 groups will be consulted during the analysis, particularly around the qualitative findings and the process evaluation. And that's to make sure that we're capturing kind of different interpretations and perspectives, particularly around kind of emerging themes and things like that. Community representatives are going to play a really, really key role when it comes to dissemination, particularly for public facing information. There is a potential for sort of out of court disposals to be seen as kind of quite controversial. And so, we feel like it's really important for us to be aware of potential concerns within the community, but, so that we're able to appropriately articulate any potential benefits to the programme, address kind of issues, talk about the study in a way that's actually meaningful to communities, and that people can kind of really kind of get on board with and understand.